Hi again, it's Layla, same person, same midwife up at Cramlington Hospital. This little video clip we're going to look at first stage of labour, okay? So obviously we've had that latent phase, those contractions starting, the cervix is starting to change. First stage of labour is what we class as your 4 centimetres dilated, so about that if we're doing guesstimations, and the cervix is lovely and thin and we've got those nice regular contractions coming. It doesn't matter whether your waters are broken or whether they're still intact, we're still in labour. At this point, again, you might have thought about different options of pain relief. You might still be at home and coping and breathing through. Those of you who are hypnobirthing, you will have all your techniques in place, and we'll be aware of that within the birth plan that you've produced. So what we're looking at this point is how these contractions or surges, it all depends on how you want to voice, how you want to see what your body's doing to give birth to this baby, is how it works. Basically, I will use the word contract because your uterus, your womb, which is carrying the baby, is like a big muscle, okay? So you have a contracts, it tightens, and it starts right at the top, right up the top of your uterus, and it basically works its way down like this until it gets to the cervix, low down in the pelvis, and it helps to start to dilate that open. It's quite intense, okay? So again, you should have your midwife there supporting you, keeping you mobile, keeping you active, looking at what your choices are for this first stage of labour. Obviously, we look at your cervix changing from being completely closed to being 10 centimetres dilated. And it's very dependent on each woman to woman how long this phase would take, how long is a piece of string. As a guide, we do see you tend to, especially from the 4 centimetres, you tend to dilate for anything from half a centimetre to a centimetre every hour. Within this period of time, we tend to ask whether it's all right that we assess you, and this is by vaginal examination usually, but also we look at factors of, we will feel, so your midwife will ask if they can put the top on the hand of your stomach so that we can feel the strength of them, we can see how long they're lasting, we can see how you're changing through your labour. We can see within your behaviour, so you might be quite calm and then you go through the transitional stage where you start to feel a little bit frightened, or you might be more vocal than you previously have been, or you feel like you can't do it at this point. And for us as midwives, we've seen this and we know that this is all normal part of this first stage of labour. And as I say, a vaginal examination is another way that we can assess, has your cervix changed? So you may have been 4 centimetres, has it changed, and are you more dilated, and are you becoming towards being fully dilated? So this is what we will do. Again, it's about consent. Some women choose, they know what their body's doing, they can feel that things are advancing. This is whether it's your first baby or whether you've had 2, 3, 6, 8 babies. You might think, actually, I know that things are progressing fine, I know that I'm in labour, and you can say, I would prefer not to have a vaginal examination at this point. So please bear that in mind. It isn't a given that you have to be examined. Some people like it, it's like a score sheet. It's like, yes, I made centimetres, I've made progress, that's fantastic, okay? So what we're looking at is how we manage that first stage of labour. Staying as mobile as possible, looking at your options for pain relief. Are you doing this at home? Is it a home birth that you are at? Knowing when to call your midwife if it is a home birth, so you've got somebody in attendance. Or when do I phone in hospital and I'm going to come into hospital and have the support there because I've planned to have my baby in there with midwives present. So it's all about how we can support you in this first stage. And again, it's birth plan is a great thing to have, but please bear in mind, a baby will decide when, and a baby will decide how it's going to be born, okay? So as you are in labour, we will be monitoring, like we've talked about in earlier slides, we will be monitoring the fetal heart, we will be monitoring your baby and how you're doing. If there were concerns about how the baby was, so if we were called fetal distress, then unfortunately, regardless of how dilated you are, we might have to think about delivery of that baby. So you may not get it fully dilated and may have to have an emergency cesarean birth. So that is something that we will discuss and give you further information on. But hopefully, and what the majority of women do, is they get a full dilatation, and this is when we advance into second stage of labour. And from there on, you are going to do fabulous, you're going to birth your baby, and we are going to support you in that.